The day begins, and stories break.
This is the National.
From conflicts abroad.
They managed to push through police lines.
From the centers of power.
This is the National.
When they get too close, they fire tear gas.
To your front door.
This is the National.
I'm Sasha Petrusik at the entrance to Aleppo.
This is the National.
The experienced Canadian perspective
This is the National.
unfolds.
There it is, the search headquarters for the past few weeks. This is the National.
Tonight on CBC television.
Most of the big studies on the health effects of cell phones tell us we don't need to worry. But tonight, the CBC's Wendy Mesley discovers that one of the world's largest industries is taking the possible risks very seriously, trying to make sure they are covered if a link to cancer is proven down the road.
And the cell phone industry say that most of the science doesn't show any risk from using a cell phone. But in her new book, environmental health expert Deborah Davis reveals some insurance companies are worried cell phones could turn out to be another asbestos, costing the insurance industry billions of dollars down the road.
There was growing concern about this issue, that this could turn out to be as bad for them as asbestos turned out to be when some companies went under because they had written policies to provide secondary insurance to asbestos companies.
In her research, Davis discovered that instead of relying on studies supported by the cell phone industry, one insurance company hired an independent scientist to do some tests. We tracked him down in Vienna, Austria.
Hello?
Dr. Muscular?
Yes.
Wilhelm Moskuller's study shows cell phone-like exposure damages DNA. Those trails show DNA that's been broken. His work repeats the findings of several other recent studies.
With this hint that there are DNA breaks, people believe that this is a very strong hint that there is a cancer risk, but it's not a proof that there is a disease related to it. We need further data to confirm that it is relevant for the living humans.
His research was done for the Austrian Workmen's Compensation Board, a partly private, partly public insurance company that now opens the door for health claims in Austria. And at the Italian Workers' Compensation Board, there's already been a claim. Just last year, an Italian executive was awarded major damages for a brain tumor he says was caused by holding a cell phone to his head for several hours a day over several years. That case could set a precedent in Europe. So what about Canada? Well, we contacted most of the provincial compensation boards who said that any potential claim here would be judged on its own merits.
What about the companies that insure the cell phone companies? What are they saying?
Well, a little bit different there. They're saying, we've talked to two brokers from two of the biggest global insurance firms, and they tell us that about 60% of underwriters now refuse to cover cell phone companies against any potential health claims. And Swiss Re, that massive reinsurance company, tells us some insurers have even done modeling forecasting to 2020 and 2030 to see if brain tumor claims do come along, what it might cost them. We also checked in with the manufacturers, BlackBerry, Apple, and Nokia, to see if they're covered, but they wouldn't tell us. Same story with the telecoms, Rogers, TELUS, and Belle.
Lots more in your interview with Deborah Davis coming up this Sunday night on the National, right? Thanks, Wendy.